Hello, everybody. Good afternoon, and welcome to part 2 of the CARPHA COVID-19 Health Rounds. Today, we're going to be talking about managing evacuation shelters during the COVID-19 pandemic. We'll have 4 presenters today, myself, Peter Williams. We have Bradshaw Isaacs and Dr. Kim Newton-James, who are in our St. Lucia office. And we also have Dr. Stephanie Fletcher-Lartey, who will be presenting today. So let's go ahead and get started. There's a lot of disasters that bring to mind the need for shelter. People, when their homes are destroyed, need a place to stay, and we want to make sure that they are well taken care of. And some of the ones that maybe we think of right away are the big disasters that bring in a lot of attention, such as the earthquakes or volcanoes or hurricanes. But there's also other smaller ones as well. Disasters on a local level, such as fires or floods, a building collapse, or even an industrial accident, would require people to evacuate their homes. And so, though it may not garner an international response, on these smaller levels, these people are still seeking shelter. And so we want to make sure that we're providing good sheltering during this pandemic. And then, of course, there's also things that might garner a national level response, such as a smaller scale natural disaster. For instance, Belize just had a Category 1 hurricane come through that they did have to shelter people, but it didn't trigger a large scale international response. Or perhaps even there could be a mass migration that we see people migrating and needing shelter while they're experiencing that difficult time. So those are the kinds of things that might push people to shelter. And so we just want to talk about how you can do that safely, how you can take care of those people in a safe manner in the midst of this pandemic. So just a little bit of an outline to look at what we'll cover. We'll talk about your shelters that are already designated as shelters. Many of you have your community shelters that have been designated for a long time. So we want to make sure that you do a good assessment of the building, that you make sure you have the appropriate supplies, and that your staff are well prepared. And then we'll talk about so that would be kind of the preparation phase, and then we'll get into the managing shelters phase, talking about doing admissions and taking people in, working with people who may be ill, and then look at things like doing food service with the people, having good cleaning services and good waste management. And then at the end, we'll talk a little bit about cleaning up after the disaster and making sure your building's ready to go back to its normal use. And then I'll show you some CARPHA products as well that would help you bring in things in the future to help you think about all of the different aspects that you may need to consider. So we know that COVID-19 has been raging for quite a while. These numbers are a few days old now, and they continue to rocket up. But globally, we were looking at 25.8 million last week. Here in the Caribbean, we've seen 172,600 cases. Many of those have recovered, 97,000 about have recovered, and we've seen about 2,900 deaths. So that's just to give you a picture of what it looks like here in the region, just to keep that all in mind as we're going through this. I'm going to take the opportunity now to hand this over to Bradshaw Isaacs. As I said, he's in St. Lucia. Bradshaw has 15 years of experience working in environmental health. He started his career as a public health officer in Jamaica and went on to work sorry about that. He's worked as a public health officer in Jamaica and went on to work in the private sector with bauxite and alumina and power generation industries. Bradshaw joined CARPHA team as the technical officer for occupational health and safety and indoor air quality and serves as the officer in charge of the Environmental Health and Sustainable Disease Department in St. Lucia. So I'm going to hand it over to Bradshaw, and I'm going to let him share his screen.
Thanks much, Peter. I'll share at this point.
Yeah, that's right.
Good afternoon, everyone. I'd like to start the presentation by looking at shelter selection. As Peter mentioned, usually shelters are pre-designated, but within the context of COVID, it is possible or maybe even necessary to do some reassessment of the shelter that exists to see how well they fit within this new pandemic situation. So I'll start by looking at shelter selection. So the process of selecting shelter must be more than just designating all schools or possible churches as shelters. Not all shelters are suitable for all situations. The situation in terms of selecting a shelter should be involved and an informed process. What does this process entail? Usually it involves a national shelter committee. Maybe there is a different name in other member states, or it may be a subcommittee from this group. But what is important is it must be a multidisciplinary approach. Usually the team comprises of physical structural planner, building inspector, possible contractor, the national disaster coordinator, fire will be represented, police department will be represented, health will be represented, public works, NGOs, and so on. You'll select. This committee should meet and determine what are the shelter needs for the particular region or the community. So you will determine, or the committee should determine, what are the possible hazards or risks that the community would face. And as Peter mentioned, it's not only just hurricane, it could be earthquake and so on. How many persons are at risk or will be impacted by the disaster? What's the capacity of the present or existing shelters that we have? And what would be the need for future? Then you'd put together a possible list of shelter within the region or within the community. And having put that list together, what would be required is a joint team effort to determine or to do or conduct an on-site evaluation of the location and of the structure of the building. What are some of the things that we would expect from a feasible location? It must be accessible. There should be multiple routes, if possible. Adequate parking space, taking into consideration delivery of items for relief. Proper lighting along the way to facilitate night access. We can never tell when there will be a disaster. It should be away from likely flooded areas. That would be for rivers, canals, open drains, for example. We should also be mindful of what is upstream of the area. Should, in case there is a dam, for example, should there be breach of the dam, would the facility be flooded? Should be away from coastal plains, and certain standards would set a particular distance above sea level. But we are aware that within the member states, there are countries that are below seawater level. There are some that there are not many hills, and so that determination will be made within the particular state. It should be sheltered from high winds, and this may be other buildings, it may be trees as windbreak. There should be no possibility of a landslide or boulders running from a hill to cause damage. It should not be threatened by falling trees, power lines, flying debris. When we talk about debris, we must be mindful also that the inspection or the assessment would not only be on the particular premises, but we need to be mindful of what is happening in the neighboring community or premises as well. Also, it should be away from potential sources of hazard. And what do we mean by that? For example, it should be away from a gas station, maybe proximity to refineries, fuel storage areas, warehouse where there are stockpile of pesticides, hazardous chemical and materials. In the assessment process, we'd also like to take into consideration the shape of the building. Usually, it is expected that the building would be at least 3 times longer than the width. There should be adequate storage space, and the storage space will be determined by the length of time that the persons are expected to be there. Usually you'd want to consider space for maybe the shelter manager and the staff of the facility, but you'd also want to take into consideration living requirements, sleeping requirements, and preferably you'd want a situation where you can separate males and females. Should have at least 2 entrances and exits, and these should be kept clear at all times. The building height, you want it to be at least 2 stories high or less. The lower the better. The ceiling height should be at least 10 feet, and that would be the distance from the lowest end to the ceiling. There are some important questions that you'd like to ask as you conduct your assessment. How old is the building? And it's not necessarily that the older buildings would be less stable. No, in most situations, there are older buildings that are more stable than the modern ones. But it would also give some implication or information on the type of building material. And I'll mention, for example, back in the 60s or before the 60s, asbestos containing material was predominantly used in building construction. You'd want to be mindful of that. You also want to take into consideration if the building survived previous hurricane or earthquakes. This might indicate the probability that it will survive a future event. Is the building maintenance up to date? Is it adequate? Does the building appear to be in good repair? Look at such items as the door, painting, windows. Are they operational? Look at your light fixtures. Are they burnt out? Is there dangling wire from the electrical outlets? General cleanliness of the facility, whether, and that is in and out, is the premises bushed and well kept? And you'd also like to take a look at the roof. What type of roof? And that will have an implication on the designation of the building in terms of earthquake ready, in terms of hurricane ready, and so on. But in essence, a tile that is firmly attached, galvanized metal that is securely attached, a concrete roof, they are usually the best type of roof for disaster preparedness situations. The walls, they should conform to the local building code. Usually we expect the external walls to be at least 8 inches thick. They should be in good condition. So are they free from large cracks? Is something that you'd want to look at. There should be no moisture intrusion, signs of leaks. There should be no visible signs of mold growth. And you want to know if the walls are properly reinforced, if they were designed to prevent moisture from coming in. By way of construction, the rafters, are they properly attached with bolts or cables? Are there hurricane straps? The windows and doors, if they are glass, are they properly protected by shutters? Are the frames properly affixed to the wall? And usually they would say the frames should be at least 3 inches thick. It should be properly sealed so there's no possibility of water entering below the area, the walls. Then we look at some of the possible amenities and services that the facility will offer. I will not go into much details because this will be mentioned in a future presentation. But at least we want to know that the electrical, they are working properly. So you have proper fuse, wiring, outlets, the sockets, they are adequate and they are functional. It would be ideal if the facility has a standby generator, but if not, we could assess if the wiring would facilitate such an inclusion. We look at water supply, the source, the quality, storage capacity. We want to look at the sanitary facility, wash and basin, toilets, urinal, showers. Separate facility for male and female. They must be functional, they must be adequate. And that determination, the number of facilities will determine how many persons you can actually accommodate within a facility. Storage and disposal system must be intact, and not only the internal, but the external disposal facility. Would the additional use of the facility compromise the disposal system in any way? We must be mindful. We also want to take a look at the ventilation system. And ventilation can be either natural or mechanical. A natural ventilation would be cross ventilation from a window. So you want to look, for example, openings to the facility. Are they wide enough to facilitate proper air movement through the building? And so on. Mechanical ventilation, there may be central, there may be split. you want to know exactly what type of facility, what type of mechanical ventilation there is. So for example, a split unit would be designed to cool the internal structure of the building, but not necessarily designed to exchange the air within the facility. There are central air conditioning systems that are closed, so they recirculate the used air. There are central air conditioning systems that introduces fresh air within the occupied space. So we need to know exactly what it is that we have at the particular facility. At the end of the day, we want to ensure that there's adequate fresh air exchange. We want to look at the service or the schedule maintenance of the air conditioning system. We want to know if the appropriate filters are being used. Within the context of COVID, we would talk about, for example, MERV, which is the minimum efficiency reporting value of a filter air conditioning system. And this is a filter that would remove minute particles, 0.3 to 10 microns. Maybe complicated a bit, but these are what we would consider to be respirable particles. We can actually breathe those in, and those can cause ill. To the end of that would have, for example, the HEPA filter, which is high efficiency particulate air filter, which would be one of the most efficient in terms of removing small particles. So we need to look at the system that we have, what we are using, and the appropriateness for this particular time and situation. At the end of the assessment, what is important is to make a designation. So it's a team approach. Each discipline or professional would go and take a look as it relates to their particular skill set. Then the team would meet, but at the end of the day, there needs to be a designation. What is this shelter best suited for? Will this be a temporary shelter for the protection of hurricane? So persons would be able to safely move towards this shelter pre-impact and would be considered to be safe. Is it a temporary facility that following a disaster not caused by earthquake that you would go, or a facility that you could go after a disaster, for an earthquake, for example? Or is it based on the facilities and the amenities? Could it be considered, and the structural stability, could it be considered a long-term shelter? You can enter pre-impact for a hurricane. You can be there following a hurricane for extended period of time. Is it more suited for an earthquake scenario? Could it be used for other purposes or events? So it would not be a wide-scale selection that this facility is a designated shelter, and it would be accepted that it would be so for all events. We need to make that distinction, having done the assessment, and that is how it is that we have an informed and involved process in selecting our shelter. I would now like to use the opportunity to introduce my colleague who will continue the presentation. She's Dr. Kim Newton-James. She's currently the Technical Officer for Chemicals and Solid Waste Management at Environmental Health and Sustainable Development Department here in St. Lucia. She serves on the CARPHA Emergency Response Team. Prior to joining CARPHA team, she worked as consultant for CARPHA as Waste and Chemicals Management Specialist on a regional project. Dr. Kim Newton-James. She holds a doctorate and a master's in environmental toxicology with a bachelor's in biochemistry. She also is the proud recipient of the prestigious U.S. Fulbright Scholarship. Before working with CARPHA, Dr. Kim Newton-James was a science lecturer at the Sir Arthur Lewis Community College. Part of her motivation for joining CARPHA was her interest in linking environment and public health. I now hand you over to Dr. Kim Newton-James. Thanks.
Okay, thank you so much, Bradshaw, for that very nice introduction. And I just want to say pleasant afternoon to everybody. So my presentation is on shelter amenities and COVID-19 considerations. So I will first look at heightening existing measures at the shelter and implementing new measures in light of the COVID pandemic. So one of the major areas that has to be heightened or strengthened and also reevaluated in these times, in this pandemic, is WASH. And WASH meaning water, sanitation, and hygiene. So we know WASH is more vital now than ever before. Why? Because we know that the spread of COVID-19 is very closely related to water and sanitation. This is why we must have an adequate supply of water from our central supply system, as well as emergency water supplies. To date, just on a side, to date, there is no evidence of the presence of COVID-19 in drinking water. And we know that our conventional methods of treatment, for example, filtration and disinfectants, are sufficient to remove as well as inactivate the COVID virus. But in the shelter situation, we have to ensure that the infrastructure is sound in terms of not having damaged pipelines or leakage in the lines, and that the plumbing is functional, and this in effect will prevent our water from being contaminated from outside sources or internal sources. So the recommendations for this emergency supply would include ensuring adequate storage of water, not just any water, but potable water. So this means that there must, at some point in time, be testing for residual chlorine in the water. In some cases, we see it should be greater than 0.5 milligrams per liter, and that this is at pH of less than 8, right? One could also consider installing water purification systems. And if not, then for smaller volumes of water, you can always think of using or stocking, ensuring that you have stocked chlorine tablets, as well as sufficient bleach for water disinfection. Another important aspect in the preparation is that there must be a plan for transporting truck water if necessary, because in a situation like this, in a hurricane situation, you're not sure if the central water system is going to be compromised, hence the need for water tanks and this sort of backup. So even if your water tanks are compromised, then you have another backup, and the plan is for transporting trucked water. In the same way, this trucked water has to be portable, and there must be some sort of analysis done on the residual chlorine level to ensure that the water is safe for drinking. Another aspect of WASH is hygiene in terms of food hygiene and safety. The World Health Organization has reported no evidence to suggest a transmission of COVID-19 virus by food. However, there are concerns for consumption when it comes to raw food or uncooked. So this is something, uncooked animal products, sorry. So this is something you may want to avoid in your preparations for food at such a shelter, keeping COVID in mind. However, there must also be, well, sorry, not however, but what has to be done also is that you maintain your safety practices and also heighten good food hygiene in this case. So for example, in the kitchen area or the food preparation area, you must have a frequent cleaning, sanitizing, disinfecting. In looking at serving of the food, you should think about serving prepackaged food as opposed to serving food openly or in a sort of buffet style. Another thing to consider is recommendation is to provide the cooking and the service staff with their PPE kit, which would include their gloves, their aprons, their face mask, etc. Definitely one of the big areas is for more hand washing stations in these preparation areas, in the kitchen areas. Also, you'd want the kitchen staff to practice hand hygiene at all times and also good etiquette in terms of cough and sneezing. In looking at another area for wash and still on the hygiene aspect of it, hand washing. We know hand washing in this sort of communal sort of situation, which is a non-healthcare setting, is one of the most important measures that can be used to prevent COVID infection or COVID-19 transmission. So regular hand washing is definitely important, and it is advised that it must occur before and after activities. So in so doing, there must be some sort of functioning hand washing station placed at different areas or the common areas in your shelter. So for example, you would want these in, say, your dining area, near the entrance of the shelter. You'd want it in terms of near the toilets, about 5 meters within the location of your toilets. And these water stations should be stocked with portable water, and note I'm always saying portable water, soap, towels, soap and towels. Also, as a backup, you can, I mean, it's where the money goes and where the money can reach, sanitizer dispensers or loose sanitizers placed at different locations or in the common areas of the shelter. So the other area for wash would be shelter hygiene. In this area, we know that research is still ongoing as to how COVID virus lives on surfaces. However, we also know that there's early evidence that suggests that they can live on objects, whether it is plastics, metals, and surfaces from a few hours to days. And in this communal sort of shelter situation or environment, you're going to have a lot of highly touched surfaces, highly touched objects. So the likelihood of these being contaminated is very high. So the recommendations are for regular cleaning, at least twice a day in the common areas or the entire all areas, and disinfecting as well. Also, you'd want to be disinfecting the highly touched surfaces with, of course, the approved disinfectants. Floor should be cleaned daily. Bathroom should be cleaned and as well as disinfected at least once a day. And the method to prepare for this cleaning would be the damp cloth method, where you use a damp cloth or a mop. And the reason being is if you use a dust or if you use dusting or sweeping, the likelihood of you getting these particles or these virus droplets in the air increases. So you would want to avoid these methods. And of course, as always, when you practicing shelter hygiene, cleaning, disinfecting, sanitizing, there is always that emphasis on providing the staff with the proper PPE. Solid waste management, another important area. There's no evidence that direct unprotected human contact during handling of healthcare waste has resulted in transmission of the COVID virus. However, there's that possibility. The possibility still exists for secondary transmission. So it is recommended, and Bradshaw would have mentioned some of these, that the waste be separated or segregated, especially where you have suspected cases or potential cases of COVID. So, and these would be usually housed in an temporary isolation area or room. So this material or any waste would be considered as potentially infectious, and it has to be separated from the regular waste and dealt with some extra precaution. In terms of bins, you must have adequate supply of bins, and these bins should be strategically placed all around the facility. So it is recommended that you have one bin, 48 to 64 gallon bin for about 30 people per day. And the space at reasonable distance apart, spread out, especially to the common areas. Again, these bins and the garbage has to be removed regularly. And if it's being stored, whether internally or externally, and this applies to the infectious waste as well as the regular waste, you must ensure that you have a safe location away from humans, pests, and scavengers. Cleaning of the bins and disinfecting of these bins are important. And of course, you would want to use the correct cleaning agents, whether it's soap, detergent, as well as disinfectants afterwards. And finally, when you look at wastewater management, again, just a little on the side, there's no evidence to date that COVID-19 virus has been transmitted via sewage system, with or without wastewater treatment. But the treatment system should reduce substantially this potential risk. So one of the big things that needs to be done is to conduct regular monitoring of the pipe works. So regular monitoring of the plumbing, and you want to look for smells. So in the kitchen area, the toilet area, the bathroom. So these are telltale signs that there are leaks. So you would want to make sure that these are not present. Again, you want your staff to practice hand washing hygiene and use the appropriate PPE during and after cleaning. And this has to do with any wastewater, gray water, when they're cleaning toilets, etc. Moving on to the next slide. So everyone here knows about social distancing or physical distancing. So just like with all other institutions where we consider COVID and try to reduce the transmission or the spread, the same applies, or the same will apply to the shelter. So this would be something that will have to be introduced as well. So in your shelter, you're going to be sheltering immediate. It's going to be an immediate shelter for some individuals. So in that case, they may be there for, say, up to 18 hours, in which case you'd want to look at separation distances from person to person of 4.5 feet. On the other hand, if you provide temporary sheltering, and this is for persons that's going to have a longer stay, in which case it will be over 18 hours, then, thank you, then you would consider a distance of 6 feet. In the case of groups and family, the distancing rule does not apply, but what you may want to do is allocate individual rooms for these groups or families or separate areas in the facility. You would also want to control, in a bid for social distances, you would also want to control the number of people in a place at any point in time. So you would opt to stagger access to your common areas for the utilities, etc. And this would be places like your toilets, your showers, bathroom, your meal dining areas, etc. And in so doing, this is where you'd have your floor markings coming in. And this is to remind people of, yes, you have to maintain this sort of social or physical distancing. So another area that is very important is staff training and communication. So in terms of staff training and communication, it may be a matter of just retraining, but the whole idea is to emphasize to your staff on how to keep themselves safe and how to keep the residents of the shelter safe as well in light of the pandemic. And also to acquaint them with the new operations and procedures. And then you have to communicate this to them very effectively and continuously. So for example, training in the use of PPE, how to put on the PPE, how to remove the PPE, cleaning, disinfecting, sanitizing the different areas in terms of the solutions that are needed, the dilution, the percentages, in what situations. Safe use and disposal of the chemical agents and disinfectants, right? Also laundering of clothes, bearing in mind that you may have isolation areas and you may have people that are tested, that are potentially infected or tested positive and are still there before they can be sent to the polyclinic or the hospital. So what happens to their clothes? The staff has to be trained on how these should be washed properly and separated from regular laundry. And as I mentioned earlier, access to information on COVID for your staff is very important. So there must be some sort of communication with the manager or the management of the shelter with the staff where current information is continually being provided to them. So yet another area that needs to be considered is emergency medical personnel. So normally at your shelter, you would probably have visits by medical personnel, which may include your doctors, your nurses. Sometimes you even have Red Cross individuals. You have individuals from officials from the Ministry of Health or the Public Health Agency. But in light of this COVID pandemic, you will have to beef up or step up these visits. So these visits may have to be more frequent. In some cases, we know that some of the shelters, the more fortunate one, may even have a nurses station where you have somebody there throughout the time. But we know that this is not the norm in a lot of the Caribbean or in the Caribbean region. But however, one thing that needs to be emphasized is that there's a need for trained individuals, and these could be your medical technicians or other technicians, to conduct screening, because this is one of the new amenities that would have to be provided in the shelter as a result of the pandemic. So you would have to have people that can conduct the screening and that can, work on contact tracing, also doing the temperature scans, calibrating the thermometers, etc. And others you would need to work in the isolation areas with the potential patients which are potentially affected with the COVID virus, as well as to conduct syndromic surveillance, because these would have to be conducted with the suspected cases on a daily basis. And also you would want to have your staff checked as well on a daily basis. A very obvious one in your preparation of the shelter would be COVID-19 supplies, okay? So this would include having bottled water, hydration fluids, disposable dishware, and this is especially in terms of COVID because you wouldn't want to have a lot of reusable dishware. Hand hygiene, again, very important in the COVID pandemic. So this would include products like soap, paper towels, hand sanitizer, etc. And as well as your cleaning supplies, your cleaning agents, bleach, your disinfectants, etc. Medical supplies, where you'd want to have a lot more thermometers, probably one per 10 persons. your first aid medicines, your Panadol, your over-the-counter medicines as well, extra linens, etc. And of course, you have to beef up on your supply of PPE. Even for the solid waste disposal, when you look at bins, you have to have a lot more bins. And then not only that, you need garbage bags, but you may want to have color-coded garbage bags for potentially infectious waste. And then you would also want bins probably that do not have lids, so no touch lid bins. So yes, so very important to beef up on your supplies. Just as important is COVID-19 awareness. So awareness information would be in the form, can be in the form of signs, infographic posters, and these would be important to ensure that the residents and the staff are constantly being reminded of the correct procedure of reducing transmission of the COVID-19 virus. So awareness is very important because sometimes you go about your business and you forget. CARPHA, we have done a very good job of helping you in this respect because on our website, we have lots of these that you can just download and stick up on the walls and so forth. So these will be mentioned a little later on and you can go and check them out yourself. All right, so again, postage of signage would be very important at these facilities. And you would want signage that give you information on the common symptoms of COVID-19, the importance of wearing your mask, hand hygiene, sneeze, cough, etiquette, reporting symptoms to the staff if you feel ill. Staff reminders as well on hand hygiene, especially when you're dealing with potentially sick or sick individuals. And one that is forgotten a lot of times is coping with stress. Little pointers on how you cope with stress in these times. And also, you would want to have signage related to restricted areas. Very important. So for example, your temporary isolation area or your isolation areas, your screening areas, etc. And the whole idea of this sort of awareness is that you want to communicate something to the other party. So if you decide to use your own posters, these should be simple, understandable, you know, and also accommodate for persons with intellectual and or physical disabilities. Okay, so this is all within preparation and of your shelter, keeping COVID in mind. So basically it just looks at strengthening measures that would have already been there, and then of course adding some new measures. So with that, I will turn you over to Dr. Stephanie Fletcher-Lartey, and I'm going to stop sharing now. Good. So I would like to now introduce our next presenter, Dr. Stephanie Fletcher-Lartey. She is a public health and biopreparedness epidemiologist with a decorated career in public health over the past 23 years. Yes, 23 years. Dr. Fletcher-Lartey, who started her career as a public health inspector in Jamaica, has returned to the Caribbean from Australia, which is very fortunate for us, where she has worked extensively across research and frontline infectious disease management and emergency response. So as I said, very lucky for us. She currently works as a consultant at CARPHA, coordinating the work of the health information, communicable disease, and emergency response unit. So with that, I now put you in the capable hands of Dr. Fletcher-Lartey. Thank you.
Greetings, everyone. Please bear with me while I get my slides uploaded. Thank you. Hello, everyone. So thank you, Kim. And I am going to be changing direction a little bit, and I'm going to be talking a little bit more about the public health considerations. All right, thank you so much for your patience. This is going to be so awkward. Can you help me? I just need to get this so I can read. Thanks for your patience. So we're going to be changing direction a little bit now. And what we are going to be talking about is what actually happens in an emergency and some of the things that we need to consider while we are managing that shelter. So as a shelter manager, with the oversight of the shelter operations, it's really important to think about some of the critical things that we might need to consider before we get to the shelter. And one of the important things that we will need to be doing before we get to the shelter, we might actually be involved with assisting persons to get to the shelter on time. So it's really important that as a manager, we get there before everyone else. And of course, the reasons for that is quite obvious. We need to be prepared. We need to make sure we get ready so that we have our paperwork ready, documentation, the name tags, labels, and any information that we might need to provide to the evacuees when they arrive. It's going to be really important. So transportation is another thing that we might need to be considering. Your role in the evacuation may be transportation. So your organization might be responsible for moving people from one place to the other. You may need to be evacuating persons from healthcare facilities or other vulnerable groups who might need special assistance. And so some considerations need to be given to these persons at this time. For example, you may need to evacuate your local hospital or your infirmary or other facilities that host vulnerable people. So in the context of COVID, what are some of the things we might need to be considering? It's really important to remember that people with illness and disease, their situation does not disappear in the middle of a crisis. And so we will still need to consider all the needs that they have, even during this crisis. And also, importantly, in a crisis situation, illness and disease tends to be amplified, or people with sickness tend to become more vulnerable. And so they need that extra special care, even more so in an emergency context. So you or your organization might be required to help relocating persons from a healthcare facility or other vulnerable groups to an emergency shelter. And so some things to consider would be the transportation. We may need to transport ill or injured persons to a shelter. The people who usually care for these persons would be ideal to accompany them, or at least someone who is familiar with their care should be accompanying them, or they can provide advice as to how best you can manage these injured or ill persons while you are transporting them. It is really important that if transportation is being provided, where it is possible, don't transport these vulnerable groups of persons with general community members, because of their illnesses, because of their injuries, they may be more susceptible to diseases. And so it's important to add an added layer of protection for these persons. So those who are accompanying them should be wearing their personal protective equipment, their mask, and those persons who are able to wear a mask, if they're ill, they should be given one as well for their own protection. In some circumstances, people may not be able to wear a mask. And so we need to consider, how do we protect these people? So here again, it's important to ensure that vulnerable people, especially those who are sick and have underlying health conditions, that we protect them when we are moving them to the evacuation site. So here it will be really critical for that physical distancing to be maintained, that 6 feet as best as possible. Or in other words, what does this look like? We may need to provide spaces in between the seats in the vehicle that is carrying them. Or if there's no alternative, then you have to move them, provide a mask, and ensure that they are protected. Where possible, it is important that we limit the use of air conditioning in the motor vehicles as well, because fresh air is preferred to air conditioning for the obvious reasons, because we want to ensure ventilation is ideal for our vulnerable groups. Ensure that you and other staff are wearing your uniform. It's really important to make sure that you are properly identified in this process so that people will know you are emergency response personnel and that you can be given the appropriate assistance or allow you to perform your duties to the best of your ability. So ensure that you provide the standard personal protective equipment kit, and this should usually contain disposable aprons, gloves, the facial protection, and surgical mask, and of course your biosafety bags for the disposal of any infectious or potentially infectious material. Next slide. So the next step in the process would be, when we arrive at the emergency shelter, some of the key things that we will need to do. And one of the most important things we need to consider is the registration of our participants. Now, before I even get into the detail about that, it is really important to make the point that no one should be denied entry into a shelter based on any personal distinctions, whether their age, their sex, their sexuality, their religious groups. These things should not be hindrances that prevent people from seeking shelter in an emergency. All right? It is really important, therefore, that we prepare for people from all walks of life who will show up in our facilities. So at checking in, all persons who enter your shelter must be registered. You must collect certain personal identifying information from them. Why do we do that? Well, one of the obvious reasons is because we want to know who is in our shelter. But it's another secondary reason is an emergency could occur in the shelter. We've had situations, I have remembered some years ago that during a hurricane response, we actually had a shelter that caught fire. It's really important to identify all the persons who have evacuated to your shelter, that in the event of another emergency in your shelter, that you will be able to identify and account for all the persons who are seeking shelter. So you need some basic identifying information, their names, their addresses, dates of birth, and contact details. And I would love to add to that you might need to collect the information of a next of kin in the event that something should happen. And collecting a next of kin or a person, another person's deed, this is important. We have seen scenarios where people have been evacuated in an emergency, especially those sudden onset disasters like, terrorist attacks and some of these situations where people have been evacuated to a shelter, but their next of kin does not know where they are. So your emergency services people will be contacting you, the media will be contacting you, and so on and so forth. Having that information, you can actually avert a secondary disaster where you are able to provide information to the authorities about who people are so they can say, okay, Joe Bloggs and your daughter is at X, Y, and Z shelter. So some of these things may not be obvious upfront, but some of this information will be really critical when people are entering into your shelter environment. Other things that are important upon registration are getting things about people's dietary requirements. Remember, in a disaster, everyone and anyone may need shelter. So the person who has diabetes will be coming. The person who has peanut allergies will be coming. All of these things need to be considered. So it's really critical to capture some of this information, because if you're going to feed people, of course you don't want to give them peanut porridge when they are allergic. And so it's important to capture some of this information to help you with managing the people who are within the shelter. All right. Now, in terms of the information that is collected, I think it is really important for us to really remember that the information we collect from people who are seeking shelter must be treated with the strictest of confidence. And yes, while people may need to be able to find their relatives and so on, this information should not be given out willy-nilly to anyone who asks for it. It should be managed, it should be controlled, and it should be channeled through the right approved sources for dissemination. So whatever information that is important, whatever information is going to help you to operate the shelter to the best of your ability, that is what you should collect. We will not collect information just for the sake of collecting it, all right? Now, nowadays with all the mobile applications, some shelters you might have an iPad or some of these things you can do on your phone, where you might be able to quickly have something like a Google form that people can register easily and provide their information. So you might be able to provide them with a link upon entry where they can quickly enter their information. Now, due to the current scenario with the COVID-19 pandemic affecting all of our member states, there is that very present danger that someone will enter our shelter who is either incubating or is currently infected with COVID-19. So this brings the question about screening. And Kim spoke a little bit about this before, but we may now need to consider implementing screening stations for people who are coming in with the assistance of our local public health staff. And many of you on this call today, you are public health staff who work on the front line. And so you will have a lot of experience in terms of screening, contact tracing, and you know the nuances and the things that are needed, the kind of information that is needed to help with the screening and identifying persons who may be at high risk of COVID-19. Screening may then become the first step in your administration and admission process. The aim of screening is to identify persons who may have potentially infectious conditions. And we're not just speaking about COVID-19 here. There are scenarios we may be in a situation where we may have other diseases in circulation that we will need to screen people for. But our current situation is emphasizing COVID-19. When we are able to do the screening appropriately, then we are able to identify persons who may need special considerations in terms of where we locate them in our shelter. So in terms of screening, we may identify persons who have symptoms or persons who are coming from isolation, or they might be coming out of quarantine and they might be in those early phases of developing symptoms. The screening process is to help you to identify these persons And then you might be able to relocate them to an appropriate place within your shelter so that they too can have their dignities preserved by obtaining shelter, but also protecting all the other evacuees from exposure to infection. So in terms of, we will talk a little bit more about this when we get down into our surveillance and prevention and control section. So where the facilities are available, it is really important that we could have our health staff on site providing assistance with the screening. And later on, when I speak about surveillance, I will show you some forms that you could use and the information that you could appropriately collect. So there must be appropriate documentation at your screening and registration station. So the screening can be a pre-preparation screening form. You can have these forms that you capture the information about each person coming in, and it could ask information such as their exposure, and people would need to disclose that they're coming out of isolation or some kind of quarantine facility so that they can be afforded with the care. Now, I know in the Caribbean context, you know, somebody might say, why do you want to know this? But what if you become sick while you're in the shelter? I would need to know what your situation is so that I can provide you with the appropriate level of care that you need. So if someone comes in, they might not obviously have any sickness, but they may know that they're coming out of quarantine, and so it is now day 7 and their symptoms may develop on day 8. That kind of information will be critical to help us in the management of the persons within the shelter, and also where possible, we will be able to identify an area for isolation. So it's really important for us to think about how will we manage all of this. There has to be some kind of planning that goes into it. And we can't wait until the day when we are evacuating people to put that planning in place. The health planners, the local government planners, the persons who are at the National Emergency Operations Center, the local NGOs, our civil society groups that provide support for us, we must be speaking to each other now before disaster strikes. And while we are speaking, this is a good time to plan. How will we manage persons who are coming out of isolation? How are we going to manage persons who are coming out of quarantine? Are we going to have a special facility for those persons? Will these facilities be enough? What if the facility is located in the north of the island and the disaster strikes there? How will we get the people from the south to that facility? Do we need an extra facility? These are the kinds of questions that we need to be asking, and we need to be speaking to each other about. So it's important to liaise with our local health authorities to identify the staffing needs, because we will need someone with some amount of experience and training to be able to assist with screening of persons and to interpret the information that they will get through the screening process and what to do with that information. So some special considerations during the registration process for people who are known or suspected of having COVID. This may include identification. We must have a means of identifying the persons who are suspected or confirmed with COVID-19. Now, one of the things that we know can very well become an issue in our context is the information and confidentiality. You know, as Caribbean people, sometimes we like to give people names, but it's important that the information is kept confidential. If someone has disclosed that they are infected and they have come for shelter, their information needs to be protected and their identity needs to be protected as best as possible in the context of management of the shelter. Those who need to know should be made aware, but the entire population in the shelter doesn't need to know that Stephanie Fletcher has COVID-19. So it's important that as part of this process, you plan how will you identify these people? Will there be somebody located there to do the screening? Will they be doing the test, the swabbing at the location? Will the test be available there? Or will the screening just be as a questionnaire where people can disclose their symptoms or exposure? Now, it is important that the physical distancing, the 6 feet, is is available and that this should be able to be observed within the temporary isolation area where this is provided. So after we've identified these persons, the next step would be to isolate them. So how are we going to isolate? The question was asked earlier, how? We need to have a designated area or a room. I have inspected multiple shelters, and many of our shelters would not necessarily have enough rooms. For example, if we're using a school auditorium, there might be a small breakout room that you can use for isolation, but it might be that within that larger area, you have to create a cordon off area, an area that you create as a temporary holding area for persons who are symptomatic or those persons who are highly likely to be infected. But these decisions, as I will reiterate, that this decision must be made before the shelter is stood up. In terms of infection prevention and control, this is another very important area of our planning. We must identify the appropriate cleaning and disinfection procedures that need to be followed. Kim spoke at length about the materials that we would need to use, so I'm not going to go into that. We need hand hygiene facilities and our personal protective equipment, as we mentioned before. So another consideration would be how long people will be staying in our facility. This is going to be really critical to help us in terms of the kinds of decisions that we are going to make about where we place people and how we facilitate them or we accommodate them in the shelter. Bradshaw has already spoken about the specifications for the building. But in terms of housing people, how are we going to determine where we put people? So in the short-term shelters, where stay is expected to last for about 18 to 24 hours, persons with symptoms who arrive with their family members, they should be able to stay with their family members in their groups, especially if you do not have additional facilities to host these persons. So these persons, if they're coming from home, they have been with their family, so the risk to their family is not going to change from them. So they can stay with their family and they remain together. But of course, we would expect that they would be protecting everyone else by wearing appropriate personal protective equipment. For example, the mask, and also maintaining their physical distance from other people, and also ensuring that they're following the cleaning and disinfection protocols that have been put in place. They should also be encouraged to limit their movements through the facilities. So yes, while we are cohorting you with your family, you are staying with your family, it does not necessarily mean now that you can run up and down across the facility because you have been identified as having symptoms of COVID. You should remain in that area as much as is physically and possible or safe to do. So the matter becomes more complicated when we are talking about longer term sheltering. And we know that in the Caribbean context, there is always the possibility that some of our evacuees will need long-term sheltering. We've seen so many disasters in the recent years, and this has shown us how some people will need a bit more longer term. So some people may spend 3 to 4 days, but some people may end up being in shelters for up to a month or even longer. So careful planning must be made for the facilities that are designated as long-term shelters. So now is a time when we begin to think about which shelters will we use as a long-term shelter. If we use X facility as a short-term shelter and the emergency situation requires that some of these people may need longer-term shelter, are we going to move them to a long-term facility? These are the kinds of conversations that we need to be having at this time. So your organization might be involved in making those decisions. And so it would be important for you to bring these kinds of questions into your planning process to help with the decision about where we are going to place people who require long-term sheltering facilities. The usual safety and security risks are to be assessed. But in the context of COVID-19, the risk assessment must now include the disease transmission-based risks. It is going to be more critical now. Back in the days when I used to do inspection of shelter facilities, the inspection would usually follow the discussion that Bradshaw and Kim has. And to some extent, we might think about disease, but not at the scale that we are thinking about that today in the middle of a pandemic. So some recommendations would be do site-specific risk assessment. The risk mitigation strategies must then be implemented based on your risk assessment results. So these strategies are similar to what Kim spoke about earlier in terms of the water sanitation and hygiene measures that will need to be put in place, the infection and prevention and control, the waste management, and of course, the medical management of persons who are symptomatic, because as we've seen, there are some people who may not have any symptoms at all, but there's another group of people, they might feel well today and then tomorrow their symptoms take a turn for the worst. So these kinds of considerations must be given ample amount of thought before we need shelter. And of course, it is really, really critical that there is coordination. So I know some of you might be saying, but how are we going to do all of this? There has to be coordination. And that coordination, there must be someone who is in charge of all of this, and team members have specific responsibilities. But as part of that coordination, we need to have that documented plan for how we are going to manage our shelters. And those plans should itemize the roles and responsibilities of the different persons, the different organizations, the different key people in their evacuation and their response. It is important for us to think about the separation and isolation situation because this is going to be critical. We don't want people to refuse to come to shelters because they are not feeling comfortable. We've seen this happen with other things that have happened most recently. People have refused to leave their homes because of the fear of contracting illness. So these are things that we need to consider. And we also need to consider the importance of communicating these plans with people before the disaster strikes. So they know that we have done all that we possibly can. We have made all the plans. We have considered X, Y, and Z. And so now you should feel confident in an emergency that if you need to evacuate for your safety, then we have considered all the requirements and we've put things in place to protect you and your family. And finally, on this topic, it is important that we identify those designated health facilities that we are going to need in the event that something takes a turn for the worst, in the middle of our emergency and in the middle of people seeking shelter. Where do we take these people? If someone begins to develop shortness of breath, they cannot breathe, what is our protocol for this emergency within the emergency? And before I close off, I just wanted to add just a few notes on equity and social protection. In all circumstances, but most importantly in an emergency context, the measures must be implemented to protect equity, to promote equity and social protection. It is rather unfortunate that we live in a world where people are often discriminated against because of the way they look, the language they speak, the way they dress, the God they serve. It is very unfortunate, but it is a reality for many of us. So it is important that while we are doing our assessments, that we consider some of these uniqueness, these individual characteristics that may place people in a situation where people can discriminate against them, and that we ensure that we do not discriminate against them because of their differences. So our assessment must consider the needs of these unique individuals. Are males and females going to have different needs? Yes, we will need to make sure we have separate toilets for males and females. What about the children? Who is going to protect them? We need to consider the needs of people of different age groups. The very elderly people will have some needs that other people may not have. So this is the kind of consideration that we are thinking about. In our Caribbean context, we are now seen more scenarios where we have to deal with vulnerable groups such as migrants and refugees. And this is something that we need to consider in terms of how will we deal with people of different language backgrounds. Many of us, we've grown up in a society where we speak only one language, but now in the last couple of years, that has changed. How do we deal with somebody who cannot understand a word of what we are saying? So it is important that we make a plan. We must make a plan that identifies how we are going to deal with these unique situations that may present in terms of our vulnerable groups, people of different age and gender, people with disabilities, people living with HIV and AIDS, people who have to take certain medications. How will we plan? How will we manage their specific needs as a result of their underlying situation that may place them in a position where they need special considerations? It's really important that we think about the language barriers, as I said, and the kinds of signage that we're going to put up. Are we going to consider doing multiple languages? It's important that the information we communicate reaches to all the participants and that they can understand, because that is going to help us to get the message across. It is also going to help us to increase compliance. So some key questions that we could ask ourselves while we are planning is, how will we communicate our important messages? How will we ensure that people are not marginalized or mistreated because they speak a different language or they do not understand what we are saying? How can these groups be involved in the design and the readiness and the response that we are mounting? How can we get their contributions to our plans? Do they have special groups that represent them, that we can get their voices to be represented in our planning process? And in some circumstances, we may need to provide some kinds of incentives for people to be open and transparent. For example, if people feel like the authorities may arrest them if they come to the shelter because they might be an illegal immigrant, we may need to make it very clear that the shelter is open and available to everyone and no one will be particularly discriminated against because they are in that safe space. And just to wrap up, let's talk about surveillance and reporting. Now, after all the hard work, after all of this planning, all of this risk assessment, all this preparation, there's going to be some very critical information that we need to collect. The data from our shelters will be valuable, not just to you in terms of how you have managed the shelter, but your organization, the donors who are paying for the material or the resources. You may have international development partners who have special interest in the information that is coming out of your shelters. And of course, your Ministry of Health, your ministries of local government, the persons at the national level, your political leaders will need this information. So the data that is collected will be valuable as a means of accountability. So there are two types of information that will be valuable in the current pandemic context. This includes general information. Now, when I say general information, I'm talking about the information that you will collect at registration. The age groups of persons, the number of males and females. This kind of information is very useful in terms of informing national statistics and vital information at the national and subnational levels. We want to collect information in terms of how we have used the supplies. How are we monitoring the supplies that we are using in our shelters? And how are our resources doing? Somebody needs to be keeping an eye on the resources so that we can get replenishment before we actually run out. So that's the general information. And secondly, the other really important information is going to be disease surveillance data. So our shelters have become our temporary community. So our community has moved into this really small space, but their lives continue. They still have symptoms. Their situations do not necessarily change. So the need for surveillance is going to be very critical in the pandemic, especially with the added risk of disease transmission. So we're going to need to provide information on evacuees. So the temperature monitoring, the routine surveillance, the daily surveillance information, the monitoring and screening information that you collect at your screening station. But if you are in a long-term shelter, this data now becomes even more valuable. So you will be doing daily monitoring to see whether people develop symptoms. How many people in your shelter had symptoms? How many people had fever today? How many people who came in and were healthy, how many of them have now begin to show symptoms? So this kind of daily data collection is going to be critical to help your public health people to manage and to plan and to respond to their epidemiological situation. And here, I'm not sure how well you are able to see this, but I have at the bottom of the screen to the right, there's a daily epidemiological surveillance form that can be used to capture information for each person in terms of their symptoms. And this information, you can summarize that information and share that with the local health department. So the daily surveillance form can be used by non-health workers, but someone with a fairly robust knowledge of health. So they would understand what fever is, and they would be able to understand how to distinguish between people with different kinds of symptoms. And that this information will be able to provide information on situations that occur in the shelter to assist with decision making. And secondly, the information must be collected for your healthcare workers. So if we have healthcare workers who are positioned in the shelters, it would be important to be capturing information about persons who are looking after persons with symptoms, other people with special needs, elderly people, people who need to have medication taken daily and so on, to ensure that information is captured on a regular basis. Now, I am going to change gear a little bit, and I'm going to invite Mr. Peter Williams to come and finish off this presentation, and he will speak about managing illness in staff and evacuees. Now, Peter has a Master of Public Health degree from the Tulane University. He worked in Liberia during the Ebola outbreak. In 2014, he also worked in Atlanta in support of the South American countries during the Zika virus outbreak in 2016. Additionally, he responded in Haiti to the earthquake, and Peter has also extensive experience strengthening hospitals and health facilities and in countries like Gambia and India and Honduras. Please help me welcome Mr. Williams.
Hello, everybody. It's me again. Thank you, Stephanie, for that nice introduction. And so I'm going to start. Oops. Okay. I'm going to talk a little bit about managing illness in the facility, both by staff and by residents, by evacuees. So the first thing I want to say is that any staff feeling ill should stay at home. That should be always communicated immediately back and forth. Just let them know to stay home, and that if they're feeling better, if maybe they get over it quickly or something, that's okay. But to protect everybody, anybody ill should stay home. You also want to ask your evacuees, the people that are staying, and your residents, to come to you, to feel open and able to come to you when they have symptoms. Have them self-report. Additionally, you can ask them, hey, I noticed that you're having a cough. Is that new or is that long time? Do you feel feverish? Ask them, talk to them in the day-to-day interactions that you have. And assure them that it's not because you want to send them off or you want to get rid of them. Assure them that you want to make sure that they're able to have the health care that they need, that they are able to get the support that they need. Remember that you don't need to chase down every cough or sneeze that you hear. You don't need to have your no-touch thermometers in a quick draw holster so you can get everybody's temperature. But you do need to be cognizant, and you do need to monitor those people, and be very careful not to stigmatize people that are feeling ill. You want to be kind to them and be supportive, don't shout down the hallways COVID so that everybody hears and everybody knows what's going on, and don't recoil from the person. Remember to be respectful and be supportive and give them the help that they need. But as much as we want to protect from this, it is also likely that there may be somebody that becomes ill at the facility. Remember that the person can be a suspect case for COVID-19 if they have a fever plus one or more of these symptoms: the cough, the difficulty breathing, vomiting or diarrhea, lethargy or loss of smell. We've all heard these many times, I'm sure. So when somebody has that fever and one of these symptoms, we want you to start suspecting that right away. And if that's the case, you want to isolate that person immediately, as quick as possible. If they're with family members or other, whether it's a family member or a close associate, a partner or child or whatnot, you want to make sure that you can cohort them together, keep them isolated and separated together. If one became infected through exposure, another close contact would as well. So you want to keep them separate. And then know even now what healthcare facility will be accepting those patients. Make sure that you have a couple of backups in case that normal facility might have gotten some damage in the emergency, or they may be overwhelmed from the emergency. And so you might need to go to your second or even your third facility. And remember, don't stigmatize. Assure the person that you're trying to help them to find the health care that they need. If somebody does become ill at your facility, you want to make sure that you're able to clean up after them, that any of the surfaces they've touched or they might have come in contact with would be cleaned so that other people aren't infected as well. You want to sanitize and disinfect every surface that you can in the room where they were staying. That would be walls, tables, counters, chairs, light switches, the bed. You want to make sure you're getting all of the items too, whether it's bedding and towels, clothing, toys, books, magazines, anything that they might have come in contact with. You want to make sure it's clean so that nobody else would be able to pick up the virus from them. And then anything that can't be safely cleaned or sanitized or disinfected, you need to discard it. So, if it's a towel or a shirt, maybe it got a lot of blood on it or a lot of vomit or something like that, just throw it away rather than rather than endangering somebody by trying to clean it properly. Recognize the point that it's time to make that distinction. So I'm gonna step off of that and I'm gonna move on to some facility management issues in a day-to-day setting that you might want to think about. All visitors that come to your facility need to go through the same screening process that you would for any of your staff and for any of your residents. Anybody that's coming in, you need to know that they're not sick, they haven't been sick in the last few days, they haven't been exposed or traveled unduly. And there's a long list of visitors that you might see. It might be volunteers coming to work for your facility for a day or for a couple of days. They might be international volunteers or locals. It could be friends and family, both of the residents or of staff, any of those that would come. Delivery person or a service person, somebody that might be bringing food or coming to work on the plumbing, say, or the roof or something like that. Make sure that you're screening them and checking them that they're not sick. Aid workers that come in, whether it's Red Cross or PAHO, could be CARPHA, anybody that's coming in like that. And then when you get to the bigger emergencies, you might see celebrities coming in, They want to see what's going on. Maybe they want to bring donations. Politicians as well, they want to make sure that they're having an impact and they're having touch with their constituents. You really need to make sure that they're screened as well. And if it's a big enough person that you still want to have that that interaction, maybe it's safe, and they're showing symptoms, they've had a fever or a cough or something, maybe it's safer to have a meeting with them outside rather than inviting them inside where they could expose one of your residents or staff to something dangerous. And as I've said, any ill visitors, you don't want to admit them. And they all need to follow the same protocols that we've all been following for the last many months now. You want to make sure that people are wearing masks, that they're following the hand hygiene, washing and sanitizing as often as necessary, and then keeping the physical distance that we all know is important. Depending on the length of stay, you may be involved in some food distribution as well. And you want to make sure that you're following the food safety protocols. As I believe Kim said, it's not a foodborne illness, so that's not an issue, but anything that the virus could land on could be a fomite or a vector. So we want to make sure that we're keeping the food safe as well that you might distribute. All of your food prep people need to make sure that they're following the hand hygiene. Depending on what stage they're in, they might need to wash. If they're handling cooked food, they need to wash. You don't want to touch that food with hand sanitizer on your hands. But later, if they're a server or something like that, hand sanitizer might be okay. So make sure you make that distinction and give that consideration. Make sure that your people are all wearing the correct PPE too. That might be latex gloves depending on their position, or it might be more like a kitchen rubber glove if they're doing some of the cleaning and things like that. So make sure that those things are available. Masks, of course, are still important. Physical distancing is going to be important, and that can be a little bit harder if you're having a smaller kitchen or a smaller distribution center. You may want to consider working in shifts. So preparers come and work for a little bit, and then they leave, and then the next group comes in, and those are the cookers, and then they leave, and the next group is the servers. So working in shifts, and that might require extending the time that food preparation happens and even food service happens. And then afterwards, you want to make sure that you do the cleanup properly, that all the food surfaces are sanitized properly using the right kind of chemicals or using heat, steam. You want to make sure that all the implements, all the utility, all the knives and all the cutlery or anything like that is well cleaned. On the distribution side and the dining side, again, to keep the physical distancing, you're probably going to want to extend the hours, and you're going to want to stagger your schedules. So where your facility may have been able to churn through everybody in an hour and get everybody fed, you might need to do 2 hours. So that you make sure that not everybody comes at once and not everybody's pushing and trying to get through. To maintain physical distancing, you want to make sure that the seating is sufficient and sufficiently spaced. So if they're at a long conference table, style table, you might be able to separate them by a couple of seats and marking off which seats are people able to sit next to each other and how far they are apart. But additionally, you want to make sure that the tables themselves are spread out enough so that people will be able to walk between the tables or through the area without becoming too close to other people that are dining. So your aisles might need to be much, much larger. That might require using a different area for dining than you might normally, or people might need to go outside if the weather is okay for that, and make sure that they're finding enough space. And then cleanup, again, is going to be important. You want to make sure that the table that they're eating at is cleaned. The chairs that they're using are cleaned before the next person would come in. So you need to have people constantly coming through and cleaning up. And any reusable items, things like plates if they're reusable, cups or any cutlery. Disposable becomes, nobody wants to hurt the environment, but also that disposable could be safer. It might be most available. So just be careful of what you're using and make sure that you're cleaning it between uses so that people will be safe. So I've talked a little bit about cleaning. So let me take just a few minutes to talk about how to do the cleaning correctly. You want to make sure that you're getting all of your high touch surfaces. You're doing it regularly. That could be between use, that could be between every single use, that could be every 30 minutes or whatever makes sense depending on the number of people that you have, in your facility. So you want to make sure that you're hitting any shared telephones and fax machines, light switches, hand railings and banisters, whether they're on stairs or in hallways or wherever they might be. Make sure that those are cleaned regularly because people use them. Staff and guests' computers, if they're shared between people, you want to make sure that they're cleaned. Toilets, faucets, bathrooms, showers, all really important. And doorknobs as well, that everybody's using in and out all the time. You want to make sure that those are cleaned constantly so that those don't become fomites for disease transfer. How do you do the cleaning safely? One of the main things is going to be using the correct personal protective equipment. If you need to wear the glove choice will be important. If it's cleaning at the table between diners, maybe latex gloves are okay and they can just be changed regularly. But if it's a more intensive cleaning, you need rubber gloves, whether it's a kitchen style glove or something even heavier, depending on the type of chemical that you might be using. Masks are going to be important. A cloth mask might be okay, or a medical mask, or you might need an N95 or a respirator of some kind. Again, depending on what risk there is for something splashing back on the person and on any risk from the type of chemical you're using. A gown will be important so that the person doesn't have the chance of getting viruses coming onto their clothes at any point. Eye and face protection is going to be vital as well. If they're doing something with, if they're hosing something down and it might splash back on them, you want to be sure that you can protect their face and protect their eyes. So that might mean goggles, that might mean a full face shield, depending on what that action might be. And then apron or coveralls are something that you should consider as well. Something that's going to protect them from, and their clothes from, the chemicals that they're using. Moving from cleaning into waste management, kind of the next step there. Remember that you're going to have all of the normal types of waste. You're going to have food waste, paper, plastic, waste from toiletries, your home and office type of waste, and you need to follow those standard principles. Remembering that especially food waste is going to bring pests and animals. Their homes and their food sources have also been disrupted, and so they're looking for something easy. So you want to make sure that wherever it's being stored before it's collected is secure from animals. You want to make sure it's secure from people, from all the kids that are looking to get into things and places to play. You want to make sure that it's locked off and protected from that. And then also you want to make sure that it's protected from weather, that it's not going to flood out or be blown across a field. In addition to those normal streams, you're now going to have a new stream that you might not have. You're now going to have potentially infectious waste. And that's really going to be something that you really want to make sure that everybody is protected from that, your residents and your staff. You're going to have masks, whether it's cloth or disposable, the one-use surgical masks. You're going to have cleaning implements, Again, it could be paper towels, it could be your the gloves that people are using, cloth that they're using to clean. All of these things are potentially infectious. Any items that have come in contact that you know that came in contact with bodily fluids, clothing, bedding, towels, these are all things that you need to segregate so that they're not getting into the normal municipal waste. And then you want to be ready for people that have needles or other medical supplies that may need to be disposed of. Think of diabetics that may need to have insulin shots, or other vaccinations, or other regular medicines that people have injected. And then there's also people that may have addictions as well. So you want to make sure that those are well separated from everything. And again, these are kind of similar, but a little bit of added need for management. You want to keep it segregated from your non-infectious waste. You want to make sure it's clearly marked as infectious waste. You want to keep it secure, of course, from people and animals, protected from weather. But the last point is really important as well. You want to make sure you have specific safe removal services for that infectious waste, so that the right people are coming and it's not just being collected by the normal garbage man that might just throw it in with the normal things. So all of that service needs to be set up and prepared for, even now, before things happen. Let me talk just a minute about post-disaster cleanup. This, of course, is after everybody has gone. The all clear has been sounded and all the residents have left and gone home. All of the normal cleanup is required, but you want to assume that every surface is potentially infectious. So again, you want to go back, you want to use your normal PPE, the gloves, the mask, the coverall, the face shield, all of that needs to be used to keep safe. You want to sanitize and disinfect all of your surfaces. So sanitize is usually done with heat or with some chemicals like a bleach solution, a diluted bleach solution. Disinfect is usually a stronger chemical that requires a specific amount of surface contact. So that's where you might need to step up your PPE and make sure that the person is well protected in using that. If you are going to use those strong chemicals, like in that last point, you want to make sure that you're using them correctly, that you follow the instructions from the manufacturer for diluting it correctly, for amount of contact time, and for the protection needed. And then, of course, you need to dispose of anything that can't be properly sanitized or disinfected safely. Just take just a moment now to look at a couple of CARPHA products. These are on our website, so you can go ahead and look at these. Shelters guidelines should be coming out in the next week, hopefully. We have guidelines on food safety, frontline worker safety, both health and non-health frontline workers. We have water, sanitation, and hygiene, cleaning, and hotels. Remember that hotels are going to have a lot of similarities with these facilities. And then things about protecting people with non-communicable diseases and the elderly. And then we have all of these infographics as well. Again, on our website, at this website here, at the URL here, all of these can be products that can be posted, that can help your staff, that can help your residents as well to be able to be safe. It helps with the messaging. So that's my part of it. We are now open for questions and comments. Okay, and then I want to remind that there is a link that can be posted in the chat for people to do evaluations. Please click that link. It's a Survey Monkey, so that'll help give us feedback and know how to improve in the future. Okay, so I'm going to hand it back over to Stephanie. She's going to work on some of the questions that we've had coming in.
Thank you so much, Peter. Thank you so much. It's been a really good afternoon. We We're sorry we've used up all the time talking, but we will try to go through a few of the questions. We've had a few sent in the chat. So we're going to try and tackle a few of those questions. So the first question was, if there's no place for an isolation area in the shelter, how do we proceed? So while I was speaking, I mentioned that we may not have an area, but the advantage that we have now is we have time to plan. So it would be really important to think about, for the various facilities that you have available, how might you be able to add an area for isolation? It might be one room that you designate across the facility. For example, in many countries, I know we use schools. So in our schools, we'll have classrooms. The decision might be to use the auditorium or the school's common area for the shelters, but you might designate one classroom in the school as your isolation area or your quarantine facility. Well, you may not have a school. You may not have a facility that has multiple rooms. If you have a very large auditorium or a big community center, what you might do is to select one small area, one corner, and you box that off. You can use some sheets or something, curtains to cordon off that area, or you might just use tape, security tape. I know it's not pretty and beautiful, but we have to make the most of what we have. So identify an area where you might say, okay, this area of the facility is where we will keep people who are symptomatic, and let people know. People usually comply if you provide them with information and they understand why you are doing something. And people will know this is the isolation area. It's not for everyone to go and congregate there. So that is one thing that you could do. So it's important because we have some time in advance to think about these things. You know your shelters, you know the facilities that you have. Think about how you might be able to take advantage of any types of spaces in these facilities. Another person asks, on the same isolation area question, they talk about 6 feet is dependent on the amount of persons in the facility. So yes, the amount of persons in the facility would, in many countries, you will see that the government would say X number of persons, and they will give you a certain amount of measurement that you will need. Approximately 40 square feet per person is the average amount of space that you need. So if you're using a large auditorium or a stadium or similar facilities, then you can use that calculation. I know Bradshaw is online. I might ask Bradshaw if he wants to add anything to this, but 40 square feet per person is the recommended standard based on the Pan American Health guidelines. But once you have made the amount of space, that will determine how many people your facility can hold. But in an emergency, there's need for weighing up the need for preserving life. So some decisions will need to be made. If there is a critical situation, there are not enough shelters, are we going to leave some people to die because we don't have enough space? It should not come down to that. So we have to do our risk assessment again. Look at the risk, look at the amount of vulnerable people. So another question asks about vulnerable people. So I will come back to the vulnerable people. Bradshaw, I am not sure if you wanted to add anything to that, or Peter or Kim.
Well, not much, but just to add that you are correct that it is indeed time for such planning. So as we mentioned before, the planning committee, the shelter committee, it is now time to look at a disaster situation within the hurricane period and so on. Should there be social, physical distancing, we cannot accept the number of persons that would be normally required within a facility. So we need to look at the bigger picture. Should there be displacement? How many persons would be impacted? How many persons are likely to be in shelter? How many persons then would not be able to be accommodated? What are the possible areas? Then you do that assessment of that institution or facility to accommodate or to account for additional space. So you don't want to take care of that at this point in time? No.
Excellent. Thank you, Bradshaw. Someone asks whether if you're wearing the mask and you have 6 feet, if that would be enough. And I believe that is what most of the guidelines have recommended. If you have the 6 feet distance and you are wearing your mask, that should afford you with some level of protection, in addition to, of course, practicing the other measures, the hand washing and making sure, you are practicing good cough etiquette. And I think the final question that we have is about grouping vulnerable persons together in a particular shelter identified for that purpose. What do you advise in terms of the concept of grouping? So I spoke about this in a little bit when I spoke about the evacuation. We may have to evacuate vulnerable people with severe underlying conditions. We might have to evacuate people from health facilities. I have worked in circumstances where the hospital roof blew off. Those people will need to be evacuated. What we said up front is plan. You must identify your alternative facilities in the event something goes wrong with your health facility. We've seen it across the Caribbean where the roof or the walls of the healthcare facility, the critical facility, goes down before anything else. So as part of our business continuity planning, we must identify what is our secondary location in the event that the critical facilities are impacted in an emergency. Now, as part of that business continuity, the organization themselves should do that. Unfortunately, we know that some organizations will not do that, and sometimes the secondary facility might become impacted. So we might have to relocate people to a facility that was not necessarily built for purpose. And if people are critically ill, they will need to go to a place where they can have their critical illnesses catered to. But we may have a scenario where we have to take people from their homes. So outside of the healthcare facility or outside of facilities that cater for vulnerable people, we may have to relocate people from home, people who are ill, people who have underlying health conditions, who are critically ill, to a shelter. And in those circumstances, you may have to consider about, again, partitioning your shelter and put those people together if they need certain care, which will help the people who are caring for them to attend to their needs best. However, there may be circumstances where you have people who are vulnerable, extremely vulnerable, and they can pick up disease and different illnesses. And I believe that is the perspective that this question is coming from. So the clarification is, if you are moving people from one facility, from a health facility or a facility for vulnerable people, house all of them together because they are used to being together anyway. But if you're going to mix people from many different backgrounds and homes in one place, it's best for persons to remain with their families, number one. If that is not possible, or if people need specialized care, identify a particular area in the shelter where you will care for those people who have those extra special needs. I do hope we've clarified that. Sheena, do we have 1 minute for an extra question? Yeah. All right. We want to thank everyone for your participation today. Thank you to Peter for moderating and finishing off for us today. Just to reiterate, we have a QR code on the screen. You can scan that with your phone. It will take you to the survey. We would appreciate if you can provide us with some feedback. And we will also send a follow-up email with the link again for those of you who are not able to complete it. But we would appreciate your feedback on our webinar today. CARPHA is doing these webinars at least once per week. So please check our website for the webinars that are coming up next week. Next week we have mosquito-borne diseases coming up, and that's going to be another interesting webinar for some of you on this webinar. So please check with CARPHA's website and you will see the links for those, the registration link for that, and our situation reports will also have a link to our next webinar. So thank you for your participation today, and we look forward to hearing your feedback, and we look forward to seeing you next time. So it's bye-bye for now.